Thanks for coming. And, you know, I basically set up so that you could just, you know, talk about whatever you want to share around what this has been like for the Northeast Arc. And then I did put up a whole bunch of detail around the guidance, because, you know, that came out last night and everybody is really interested in hearing more. So if you want to share more about that from your perspective, that's great. If not, we can do it after. And then I just have a little bit of, you know, some budget bills and federal stuff to go over at the end. So,
okay.
So we'll get started in like, well, we may as well get started. I think it's a little after 11.
Okay.
So yeah, so welcome everybody. I'm just really grateful today to have Joanne Simons here. You really can't get more inspiration and leadership in our community than Joanne. So super grateful. And I wanted to take time to just let her kind of talk about what it's been like leading the Northeast Arc through COVID and what her concerns are currently going forward. But some of the other things on our agenda we'll get to after, and we'll definitely talk about in depth about the visitation guidance and some other things. So I'll just turn it right over to you, Joanne, and let you take it over.
Thank you. I'm honored because there are many people on this call that they're incredible leaders, you know, Rosalie, a lot of people who are,
on 6 feet.
my head. Yeah, I think we're probably going to have to.
Sorry, can everybody mute if they're on now, please? I'll go in and mute everyone.
Yeah, and then unmute myself. Okay, so, thank you all for being here and for your support of the ARC. The ARC has certainly been, has stepped up as it always has in good times and in times that are challenging. So most of you know that you know, I'm the CEO of the Northeast Arc, but I'm also the mother of a 41-year-old man who has Down syndrome and multiple health issues. And like many families, on March 15th, I had him leave his home where he's lived for 18 years, his house where he's lived by himself without any roommates or staff living with him, completely independent life, couple jobs, and had him come home, and he continues to be with us probably for another 3 weeks. I know the decisions and the anxiety, the angst, and the sacrifices that families have made and continue to make, and every family makes a different decision. I came across a great quote that I love, and I think it's really appropriate. Everybody's been talking about how we're all in this together, and I don't think that's actually true. We are not all in the same boat. We are all in the same storm. And when you think about the fact that it is not the same for everybody. I had a call this morning with some of our residential team, and there is no question that their sacrifices, their commitment, and the trauma that they've been through is very different than the trauma that I have gone through, which, you know, in terms of what they have had to face. So at the Northeast Arc, we were probably sort of in the middle in terms of how we were impacted. You know, over 30 homes, 5 of them were positive. Early on, we saw the storm brewing in the West Coast and took early action. And I think the lesson to be learned is that I would rather have been wrong having closed my day programs early than to have realized I made a mistake. The inconvenience of people not going to a day program for a couple days, if I was able to save a life or two, or inconvenienced folks, was a small sacrifice. We started ordering PPEs in mid-March, sourcing them from all over the world on behalf of a lot of other providers. And I think the key for us going forward is that we're looking at this as the first wave. We anticipate that if COVID-19 doesn't rear its ugly head again in the fall, something else may, and that we will never be caught unaware without the stockpiles needed to make sure that our community is safe. Because the safety of our community is directly related to the amount of PPEs that we can have. But more importantly than that, and I hope this is something that we will really begin to advocate for, is that our direct care professionals, most of them work 2 or 3 jobs. And it's that exposure which is linked to the infection rate, not only in nursing homes, but we need, while we believe that we do a wonderful job creating caring and loving communities, our group homes are small congregate settings. And as small congregate settings, they have had a risk that was not anticipated, and I don't think acknowledged by some of our state policymakers. When we were able to pay hazard pay, which is expired, and our staff could give up their second and third jobs, we saw our infection rates drop, not only in our own programs, but statewide. So I believe that there is an actual analysis that's quick to be done, which I haven't yet done, by taking the amount of deaths that we experience in the DDS system. And if we had an appropriate living wage for our staff, we can tell our legislators how much they have valued a life. And it's black and white. It's a different argument than we've been making for the last 40 years, which is they do good work, pay them what they need. No, our government decided that the value of our folks' lives had a number attached to it. And we can use that number. And it's very sobering and depressing for me to realize that that actually happened. Early on, maybe not early, midway, I was able to see an interview by an executive director of a nursing homes in Washington State, which was very hurt very badly early on. And this woman operated 3 nursing homes, had no infections. The nursing homes all around her had death rates that were extraordinary. And when she was asked how she was able to accomplish that, it was the fact that she saw the storm in China and started using PPEs before anybody else. She increased the pay of her staff, and they had to sign a attestation that they weren't working in another environment. She had strict visitation protocols, in terms of packages delivered, and although we've learned that it's unlikely that the spread is based on high touch and that it is an aerosol-borne illness, we still don't have enough information for us to change what our current protocols are. I was so impressed with her ability to have looked into the future and made those kinds of decisions and realized that's what we all have to be able to do. We, and our team thought I was crazy when I told them that we were going to take a vacant day program location and turn it into a hotel. And the hotel was, and everybody shook their head, they're going to go along with you because you're the CEO, but in reality, they thought that it was quite a stupid decision. It meant that we had to get, temporary permission to have a lodging license by the town. And it was a day hab building, so it had a lot of bathrooms and it had a lot of separate rooms, and we were able to establish 12 bedrooms. That facility was filled with staff who needed to protect their families because either they had COVID or they were working in a COVID positive home. And in fact, we had the overflow, we had to go to 2 dorms at Salem State University. We celebrated the day we could close the day program location because it meant that we had sort of, we had hit the peak and we were kind of on the other side of it. But ironically, it exposed another situation to me, that we had a staff person who continued to live at Salem State well beyond the 2 weeks that he needed in order to be safe. And that was another stark reminder that our staff are not reimbursed at the cost which allows them to, he probably was homeless. And we provided a temporary respite for him. Either that or he didn't like the people he was living with, and maybe his family was driving him crazy, and all of us felt that we might want to go to a dorm for a week or 2, but I don't think so. So my current concerns is that our staff, our residential staff, have been through a trauma. We need to recognize the trauma and provide them with the supports that they might be experiencing a post-traumatic stress syndrome kind of situation. And just hold that thought, because when we talk about the visitation policy, I think it's related, and that's one of the messages that I hope families can hear. Now, we add on that the stress, the intensity, and the call to action that we're all feeling around Black Lives Matter. And it feels that it is another storm that our staff are feeling. So as we emerged from COVID, now we're also working with our staff who are as enraged as the rest of the country and feeling the effects, because the majority of our direct support professionals are brown or Black people who have felt systematic racism from families who say to us, could you find someone who doesn't have an accent? Could you send a little white girl in here? You know, those, or our home visiting staff who hear from families and make racist comments. All of this has created, you know, a need for us to be able to continue to have even broader and more important conversations. You know, our staff, we are in a predominantly white part of the state, not exclusively, but, you know, our 11 to 7 residential staff, it hadn't occurred to me, but it certainly had occurred to a lot of other people, that when they leave the house at 7 o'clock in the morning with a little bag, walking out into a suburban house, unless everybody knows that that's a group home and that person belongs there, they're going to feel the kind of attention that young woman in Groveland felt the day before yesterday. On the other hand, so we have begun lots of conversations about race, diversity, and inclusion, doing lots of Zoom meetings, but we also have to balance that with allowing everybody to speak, and some of our staff have family members who work in law enforcement. Law enforcement actually has been protecting the Northeast Arc in, you know, many cases. They're the folks that we call upon when we have a situation where we can't handle and we don't have enough staff in our home to be able to address a behavioral situation. The police come in, those that have been trained through the ALEC program. The ARC has spent, you know, over a decade training police officers to be sensitive, law enforcement, to the needs of people with autism and other intellectual disabilities. So nothing is easy, and, you know, everything has been, I think, given us an opportunity to have this moment, to be able to do better, to have these kinds of conversations, and be able to find the real kind of pathways for us to become stronger organizations. The reason I wanted you to hold on to what staff were feeling is I want to transition to the visitation policy. Spend a little. All providers have been providing, even though we weren't allowed or permitted to have visits by family members, providers were providing opportunities for families to be able to connect. Some were more lenient than others, and some, you know, and a lot of them were subjective, based on the family, based on the individual, based on the staffing need. So for the providers to have a visitation policy that the department issues at 5 o'clock on July 1st, that's supposed to go in effect on July 3rd, feels incredibly a little disrespectful and in not acknowledging what we have been through. And it doesn't mean that we don't want families and their loved ones to be together. It means that, okay, I'm in an autumn, you know, environmental, my light just went off, so I'm a little darker. It's because it's on a timer, and I guess I didn't move around. Anyway, there I am. So we are, but on the other hand, the department has given us the opportunity to not implement it immediately. Having to implement it on a holiday weekend when the staff who have just been through the most extraordinary, stressful, traumatic time, which we would love them to be able to have some time. I'm begging our staff to take time off so they can be rejuvenated, because there's another wave of something coming. And I can't have them all burnt out at the same time. And so July 4th is a time for them also to have an opportunity to maybe take a breather from this. It's happening on a weekend. So the good news is the department has said that, you know, these are guidelines. We don't have to implement it on July 3rd. I'm hoping that families will understand that keeping their family members safe is the most important thing that we want to do. And families, and I've been saying this for the 40 years I've been in this business, families are all different. They're different politically, they're different in terms of hygiene, they're different in terms of cultural beliefs, and they're certainly different, and when I mean hygiene, I meant infection control. I wasn't making a microaggression there. And, you know, we, you know, if a family comes up and they don't have masks on and, you know, they don't believe that this is a really serious, you know, this is not the time for us to be playing Russian roulette, and we're not going to do that. So we're going to pause, and we're going to do for this weekend. It will sort of be on an individual case by case basis. It will still be visitation going on. It might not be that we're going to be having people leave and go on overnights, because we haven't had time to develop our internal policies to be able to align with DDS's residential policies. So they had sort of the easy decision. Now there are hundreds of providers that need to make sure that we have the staffing, the safety protocols. You know, if somebody shows up without masks, we need to make sure that, you know, obviously we have tons of protective equipment, but there's a lot of planning that goes into making sure that these guidelines can be safely implemented. I think they're cumbersome. You know, I think for families, that means they're going to be cumbersome for staff as well. So I'd be happy to answer some questions. I'm great at just, you know, continuing to talk and fill space. But
great, thank you so much, Joanne, because I think it's amazing what you've done with the Northeast Arc over this incredibly, you know, horrendous time, and I'm sure your staff feel your love and support, which is amazing. And I think that we are going to have a lot of questions, and I think families have read through a lot of the guidances and feel like, you know, in terms of the cumbersome nature, you know, a lot of them are ready to do anything it takes, you know, 6 masks, we'll do whatever. So I think there's a lot of families that feel really strongly that they can, you know, rise to the challenge. So why don't we open it up? I mean, I can go to the chat, or I think there's only 2 screens. So if you have a question and you want to raise your hand, we can do that. I see something in the chat already, so hold on. Okay, so Kathy says she's surprised to see that they agreed to home visitation while requiring outside visitation at the houses. Yeah, that was an interesting, you know, difference, that we could take them home and they could be inside at home, but not inside at the house.
Yeah, I mean, you'd think it would be easier for them to continue to clean the one house instead of wondering what's going on in the houses of 4 people on 4 other locations.
Yeah, I just, you know, it makes it. So today, a friend of mine is picking up her mother who's been in Arizona for 4 months, and I'm thinking, well, is the mother going to quarantine for 2 weeks? Is the daughter now needing to quarantine? I mean, you know, Arizona's a hotbed, and we don't know those kinds of things that are happening in the homes that people are visiting. So it's
Yeah, and I think that attestation is good, because it does make us go through that and really think about our exposure as family members. I'm going to ask people to put the questions in the chat, because I'm going to share my screen to the to our slideshow and go to, they are. Yeah, just some of the detail here, but let me now find the questions. Okay, guys, you have open chat questions right now. Oh, I just went off my thing. There we go. Okay, sorry, I'm not actually seeing your chats. So if anyone wants to just unmute and ask questions, that's fine too. Okay, maybe I need to stop the share, because I'm sure you guys have questions. Did I mute everybody, or?
You can unmute yourself. Oh, here's a question.
There we go. Okay. Any further guidance or screening needed for re-entry? Re-entry. Okay, so Paula asks if there's any further guidance or screening needed for re-entry. So we talking about re-entry back into the home, or are we talking about re-entry in terms of day programs? The trauma, thank you for talking about the trauma. Everyone does need a moment to breathe. Yes, Andrea, thank you.
And I think, you know, we're spending a lot of time talking about it. So, you know, I do what's called town meetings with our teams. And usually it's a time for me to be able to visit every residential program and, you know, connect with people. Now we're doing it in Zoom groups talking about, you know, race and all the issues, and really making sure that they try to take time off. And, you know, when, you know, I'm grateful that this is happening now when the weather is nice. I'm scared that if we see a resurgence in October or November and we're dealing with this over Christmas and New Year's, when we generally have very difficult staffing situations anyway, that it's so important for us to see if we can contain this.
Here's a good question, Joanne. How are the residents at Northeast Arc holding up with the prolonged social distancing?
You know, it's been remarkable. Every Friday I get something called Fun Fridays, which is pictures of what has happened during the week in the previous week. And they have risen to the occasion to provide incredible activities, you know, even when it was difficult from social, you know, distancing was, you know, people weren't permitted to leave their house, you know, in terms of being able to do walks and providing, you know, Christmas in May, or, you know, spa days, or, you know, whatever kinds of, that was remarkable. And the Fun Fridays are pretty, tie-dyeing t-shirts, all the kinds of activities. But we also were doing active programming, because our day program, remember, we deployed our day program staff to cover those hours in residential where people wouldn't have been, would have ordinarily been at a day program. So that they're doing really well. And you know, I think that what we've heard, though, which I think is really very exciting, is that there are some individuals who are actually doing better at home than they were with their families. And of course, Kathy, you're leading this effort. And I'm so excited to be able to learn from the family groups, the families who are going to tell us how to inform us to run our day programs better. You know, not that there's going to be uniform application, because everybody is different, but to give us, it's just giving us a great an opportunity to think creatively. We have a woman who wears, most of us, because I'm seeing you on most of your faces, wears an extraordinary amount of makeup, almost as if it's, you know, Halloween every day. And she spends a long time in the bathroom every day, you know, with her wigs and her makeup. And, you know, she's not going to be able to have access to the bathroom as she does. So I said, why don't you give her a plexiglass screen, give her a mirror, and let her put on makeup whenever she wants, and then put a YouTube channel on there, because there's probably other people, other self-advocates, who would love to be able to, you know, be as flamboyant as she is. We all don't have to be, you know, it's not our value. So we wouldn't have thought of that. That's what we have to do. We have to, you know, we can't change the entire system because the funding mechanisms are regressive, but we can, on an individual basis, find the joy that each person has and see if we can make that the majority of their day, not something that they have to earn, but something that they're entitled to.
Yeah, so actually Beth Swick has a great question. What is the DDS approved hourly rate for DSPs, and how much more would be needed for a living wage so that they could only work one job?
Well, it varies across the system, but it's creeping up to about, you know, $15 an hour in this area, but that's not across the board. And I don't think, if we did an analysis of the last 40 years, that we've actually made any changes in terms of the wages, in terms of against the current economics. You know, we applaud when we, you know, get some, you know, we get a small increase, but I don't think we've done anything to catch up. So I don't know the amount, because you know, I'd have to look at the, you know, pure, you know, labor statistics to be able to guess. But you know, if I could start at $18 an hour, that would be, I think, begin to address it. I was on the Cape, and Stop and Shop is saying, you know, they're looking for entry-level people at $16 an hour. Now that's good for our consumers who work in grocery stores, but it's really, so,
Yeah.
you know, but it would also come at a higher professionalism of what our expectations. I mean, I think that, you know, for families who then sometimes have questions about the quality of our staff, and although, you know, we've been talking about how heroic our staff is, we would also like to be able to increase the skill level of some of our staff. And that would only come with being able to pay people, you know, $18, $20, $25 an hour in order to be able to get this. So I know that families, especially those families whose children turn 22, they often comment about the different, the qualifications that their children had instruction when they were in school and the instruction that they are now receiving in the adult system, because the pay differential is so great.
Yeah, Christine has a comment of, you know, is DDS or ADDP or anyone that you know of doing more widespread surveys? Because we've been doing, you know, small focus groups, and Kathy's got her great group going, and but just to get broader, and the staff, administrators, individuals, families to really learn from this experience. Do you know of anything, Joanne?
I don't know anything besides the group that Kathy and Cheryl have been involved in. And I, you know, right now we're sort of organizationally fatigued. So we're doing lots of surveys that are being required in terms of us to be able to justify the need for funding. And it's almost like we don't have the time to step back to do something like this. So I think that we can take some, I think we'll be able to, I mean, we know that not everybody did better at home because everybody's family situation is different. You know, but we, I think I think we're gonna be able to work with the information that we have.
Joanne, speak on that note, you know, how do we feel we're going to be able to go forward with the lower census for day programs?
We're going to start, you know, I think it's kind of how you eat an elephant, one bite at a time. You know, I don't have the answers of how it's going to go. I mean, we're now seeing that, you know, the 6 feet social distancing it's really 12 feet, because everybody has to have a 6 foot diameter. And when we had a discussion about this, it really, you know, pi comes into place, not the pie you eat, but the pie you know, mathematical equation. So it's really 12 feet. And if that's actually true, then it makes it even more difficult. But I think that it's really important for us to do something now that the weather's nice, to be able to at least begin to see what we need to do. You know, those of us who have found that we are not needing as much of our space for administrative purposes will be able to use some of that space for day program. But that means a higher occupancy cost for day programs. You know, everything comes at an economic cost of how are we going to actually be able to do that. I would love, if I could have, if we had a 4-to-1 ratio, you know, which we would be providing such remarkable services to more individualized support. So I'm hoping that this is the time for, you know, real creativity. I think the people in state government I mean, they're our allies, you know, they're not on an opposite side of us, but are as stressed financially and programmatically as anybody in state government. You know, when you read that Newton's solution to their special education budget is not to hire any special education aides, you know, everybody in the system is hurting. That's, you know, that's our constituents. You know, we're spending a lot of time worrying about the adults, but we're going to, you know, the ARC of Massachusetts cares about those kids. And if Newton can get rid of their special education aides, what's going to happen in Brockton and Lawrence and Lowell and Boston?
Christine, did you want to follow up there?
Yeah, I'm sorry. I was trying to type of follow-up in terms of when we look at this period and how some people have done better, and how you, Joanne, and others did a remarkable job in terms of staffing patterns and the ability to keep staff going at an incredible stressful time. I'm just thinking that it's an incredible ask to accomplish that when you've started to open the day programs, but for a lower census. And now you have some staff that previously was backing up your residential staff that's no longer available to do that because they're, you know, back in the day program, but serving far fewer people. And a lot of the people who are either in their group homes or at home, not yet coming back. And, you know, just sort of how do we advocate around that so that the system recognizes that we still need flexibility even though we're not in the absolute crisis point of the pandemic?
I'm not sure. It's a good, you know, it's because, you know, we're going to be running dual systems. You know, some people are going to stay in their residential homes, and we're going to continue to need day staff there, and we don't know. And until we have, you know, it's already the next fiscal year. Happy New Year to all of us yesterday, but we don't have any of the financial information that we need to be able to make informed decisions. And we worry about the capacity. You know, those providers, you know, there's some providers that just do day services are in a, you know, more difficult, you know, financial situation than those who had other sources of income to be able to continue to pay some of the overhead. So I don't have we'll advocate, but I mean, and congratulations to all of us, 25,000 emails to Charlie Baker. Do you think that his system just collapsed? I feel badly because, you know, he's a neighbor of mine in Swampscott, and I like him, and I think he's done an incredible job. But boy, did we show that we have a voice to hear. And, you know, I know some of you have been in this battle with me for almost as long as, or longer than I have. And we could never have gotten those numbers.
World record numbers.
You know, a few years ago. And I think that we've seen this re-energizing of the family movement with consumers, and the ARC of Massachusetts taking a leadership role. Maura, you are amazing. So
I'm amazed at the number of people. I mean, we're growing by about 2,000 to 4,000 a day, and it's you know, in part because people are understanding, they're educating themselves, they're getting it, they know what's happening, and that's so important. And you know, I really appreciate what you're doing to advocate for staff, and hopefully we can get back to the workforce crisis as well, and looking at the workforce from a Black Lives Matter and Brown Lives Matter. You know, are they getting the increases and the promotions that they need as well? So trying to look at all of these issues is absolutely overwhelming, but I feel like everyone has the passion right now, and that's what we have to really dig into. So I know we kept you a little long, Joanne, and
that's okay.
I have, if anybody wants to stay on, we can go over a few more slides. We do have a little bit of a shift to the Don't Cut Us Out campaign. So if you want to hang on, we can go through a few of those slides, but feel free to go ahead and drop off.
Yeah, I just want to thank you all for your support of ARC Massachusetts and this community, which is just extraordinary. And I changed offices, and so I came across some artifacts, and I just wanted to share them with you. Years ago, you know that we used to call people severe, profound, mild, or moderate with that other word. And so a bunch of families, like this is 35 years ago, made these pins, and we would wear them to our conferences. We would be either severely normal or profoundly normal or mildly normal.
So, great.
Great. And so what's really great is that we don't need them anymore, because we pretty much eliminated the word we were trying to eliminate. So thank you again.
That's awesome, Joanne.
But
Thank
actually,
you so much.
before anyone goes, this might, I don't know if this is off topic, but I think this is I want to know if anyone needs any gloves, because I ordered some gloves from Amazon and they just came in, but what I'm hearing now is I'm not supposed to be wearing gloves unless I'm an essential worker. That in essence, I should just be wearing a face mask, which I have, and then when I go out in the world, just don't touch things and come home and wash my hands. So I have these extra gloves, and I'm wondering if people who like work in group homes would need them more.
That's very generous, but I would tell you to save them, because you might need them in the future because somebody you love, might get sick, and it may not just be COVID, but it would just be good infection control. So I would hold on to them because I'm sure, but that's very.
But I live alone though. Even though I live alone, you think I should still?
Yeah, I think it's always good because someone who comes in. So, for example, what if you need? Let's say if you had a wound, and your caregiver, somebody was coming in to change the wound, it would be, you would have those for them. So you'd be think about making other people safe. So for my son who lives alone, I'm actually keeping gloves at his house. So that will make people who come in to support him feel safe. Even if they have their own gloves, it's a message to them that their safety is important to me. So
that makes sense. Thank you. Thanks.
You're welcome.
And lots of thank yous in the chat.
And you're welcome.
Okay, guys, I'm going to pop over to my screen again. And so these, obviously, we're going to send the slides out like we always do. In case you haven't read through the entire guidance that came out last night, I pulled some of the changes and some of the kind of more important things to us as families out so you could see. But you can also access the actual guidance online, and we have that link as well. So, but I did want to say that we've made a little shift to our Don't Cut Us Out campaign, and we've added another template. And as Joanne said, we're up to 25,000 letters as of yesterday, but we're looking to keep growing. And our newest template asks you to write to your senator and representative. We kind of cut them out of the picture and went directly to the governor and the speaker and the Senate president, but we need everyone on this. And as I was reaching out to reps and senators this past couple of weeks, I realized, some of them are not in the loop. And so I'd say write to them, use our template, follow up, and ask them to report back to you if they took action on this. This is where we really try to hold them accountable. Tag them, tag us, use the hashtag Don't Cut Us Out, use a photo. Those are all the ways we're going to get them to step up and realize what's happening. And we have heard some movement is happening. So even though it feels like maybe these 30,000 letters, 25,000 letters are falling on deaf ears right now, I don't think that's happening. I think we're having some movement, and at least we may have a temporary solution. Cross fingers. So stay tuned, and also, as always, reach out to the media if you can. Some of these slides are from last week, and so I'm going to whip through them. But I did want to mention, in terms of the budget and bills. As we saw right now, congregate living, as you guys all know, is the riskiest place for anyone to live. And we need to take advantage of the fact that our accessory dwelling unit bill would provide a solution for our community and for the elderly, for the aging community as well. And I think Kathy might still be on. So we actually have a new strategy for the accessory dwelling bill and one other bill. And I want, if anyone is interested, to have them follow up with me. We want to try to get the language into the governor's housing choice bill. So this is an act relative to accessory dwelling units that would allow creation of accessory apartments, in-law apartments, to a single family home for a person with disabilities or an elderly person. And as we know, the nursing home situation and the long-term care facilities really took more, at least half of the lives, from COVID. And so this is a really good opportunity for us to advocate. The governor's housing choice bill is currently in the Committee on Economic Development. And that is Senator Eric Lesser and Representative Ann Ferrante. So if either of those are your senators or reps, definitely reach out to them. But stay tuned because our Representative Christine Barber, who is the sponsor of this bill, is going to really help us push this language. And so we'll have a take action coming out on this one particular bill. And I wanted to just give you one more update, if you're still here, on the crisis standards of care. So some of you knew that we were with the coalition very involved in the revisions. And now that the hospital capacity is back to normal, there's no crisis at the moment, the guidance was actually being rescinded. So there isn't the need for a crisis standards of care right now. And that's okay, but we know that there are topics that still need advocacy. And we're actually meeting with Secretary Sutters next Wednesday and Command Chief Sutters to really talk about clearer guidance on the parent or legally responsible person accompanying during hospital care. And we all feel so strongly about that. We're also going to be hitting on training of hospital staff, unconscious bias, and what we saw in those standards of care. And also, hitting on age, race, socioeconomic inequity in rationing, and something called prognosis estimating, where healthcare professionals see a diagnosis and they're able to kind of use that to estimate life years, which is not a great way of doing it. So we have a great group getting together to try to work on these in case there is a resurgence and in case we need these crisis of standards of care in the future. So I think those are all the updates. And does anybody have more questions or want to go back to the guidance screens, or can I answer anything else? Don't see anything else in the chat, but y'all know how to reach me. Well, thank you so much for coming again, and hopefully we'll get through this weekend without too many battles, and we'll hopefully see you next Thursday.
Thank you. Have a nice weekend.
Thank you, Jossie. Take care, everybody.
Bye.
Bye-bye.
Bye. Oh, bye, Carrie.
Bye-bye.
Bye-bye.
Bye.
Bye.
Wave. Wave bye. Wave tomorrow. Wave bye.
Hey, bye. Bye, Jean. I like this because I get to see everybody's face a little bit bigger before they go. Bye. Oh, look, I didn't know you were on.
Maura, I actually have something I'd love to chat with you about in a second.
Sure.
But I don't want to interrupt the goodbyes to everybody. But,
No, I think everybody goodbye.
I know everybody has some Zoom fatigue, and people do need their weekend, that's for sure.
Yeah, yes.
We may have met briefly before. My name is Rose. I work in Medford. I work in a SPED sub-separate room in a public school. And it's the pre-K to 5 school, so they're little. They're even hard to diagnose it initially because they just have a lot going on. But some do need to go to residential homes. This is why I'm so concerned, because we have some of our students already, even so young, have needed to go, I have a son who's on the spectrum, but he lives here with me. He's, in my family, and it's a totally different situation. He can, well, not the spring, but he goes to the public high school. He's in co-taught classes.
Oh, fantastic.
He made the swim team. He tried out and made the swim team. So it's a full spectrum,
Yeah.
We know this. So he's a whole different situation, but this spring has been so difficult for him. And the whole thing makes my heart break, what's going on for the residential situation. And I just wanted to throw in a few things. So before I was teaching, I really used to work in finance, pre-kids, right?
Yeah.
And then of course with the diagnosis, it just changed everything.
Yeah, yep.
So that's why I'm working in school with the school hours, that kind of thing. And something hopefully to add from both sides of the desk, so to say.
Yeah, absolutely.
But what I'm thinking with these budget issues and the angle that we take overall, as a cohort, it's valid, it's true, but it never seems to change for the pay. It's awful, right? And it's the same,
workforce, for sure.
It's ridiculous, right? Mm-hmm. And just like what you said about Newton, where they're cutting out SPED paras, that's basically what I'm working as because I need the hours.
Yeah.
and I really want to be there for my son for all the other things he needs, for his sister, her sibling issues, just the mom things you need to do anyway.
Of course, yeah.
But the pay is ridiculous.
Yeah.
I qualify for food stamps.
Yep.
I mean, that's crazy.
You're right. We talk about the workforce, and we actually think about the school-based paras as doing better because they have benefits and stuff that are better, or more. But honestly, it's not much better.
It's not great. It's microscopically better, but it's you can get healthcare, you can get like sort of dental. There's no vision. There's no real package.
No.
And it's a mismatch for what you're asking of the people to what they get, which you well know. So maybe we should take a different angle on this because maybe put it out to like almost like a business problem. And say, like go to a school like Babson, who has like entrepreneurial people, and say, look, this is our scenario. This is always what the budget is. It's never enough anyway. Now we're in a crisis. We need to get people in, or we need to pay them better, or some kind of benefit to work there. If people aren't motivated to go, but people want to be there, it's like it's a painful combination. So I think maybe we need to put it out somewhere else and see if we can somehow.
I like that idea of almost getting a financial group to look at it outside of the disability community.
Right.
We had
I just don't think it's I think we know it's not working, and it's not that they don't care. It's just there was never any money in the budget.
I know, and we had a great breakthrough last year. So we started a workforce campaign through the ARC, and the Providers Council also was working on it. And together, in January, the governor announced $160 million set aside for the workforce. Now the COVID hit, and we know that money is gone. So in terms of our workforce campaign, it's tabled to get through COVID. And I mean, not really tabled, but we can't really, like we said, the bandwidth just isn't there. We've got to fight. But part of the reopening of day programs, which is just hugely important right now, is the fact that we need better pay to keep people on, and to have to not have to close sites. So it's like we can't ignore it. And it's interesting because my boss was just saying he wanted to use a group at Northeastern to look at something, and I didn't think about like really getting a really brilliant financial set of minds on this, So
but
I really appreciate that.
Yeah, maybe that's something to think about. Only because so I got the cat around here. She keeps scratching.
Oh, cutie.
She's just like, she's in Zoom, right? Yeah, so she's everywhere. But she hates Zoom. Yeah. So, but maybe it's just maybe that's something that could help. I
really like that idea.
Something to consider. And again, it would maybe take a little pressure off because somebody else could maybe add to like the looking at this, not just the heartbroken families, the exhausted, like emotionally traumatized, exhausted people that, sort of live in this space.
You're so right. We need fresh eyes.
Maybe we're just, we do see it from so many angles, but we're living it too, which creates its underlying stress. And I mean, almost in a way, like when we see the families interact with the kids, then we as educators interact with the kids. It's different because we all love them and care about them, but in a different way. Our way is a little more clinical. It's a little less emotional because, like it's just that slight difference. So maybe that even could have a different way to look at this sort of problem, if you'd say, like just staffing, payment, retention, because the consistency for these kids really helps them too.
Yeah, absolutely.
And you're going to only get turnover, as you know, and hard to staff and so many issues. So one thing, maybe it could be something almost like set up a program, almost like, or incorporate Big Brother, Big Sister to help these kids have somebody and be less isolated. Somebody sort of with an already trained programming, maybe plug them in with like a slight adjustment. Or something almost like a city year or Peace Corps. Maybe people can go and work in this field, almost like a medical rotation, like residents do. And maybe just see, like, how do schools run? What's the para do? What is the, you know, what do they do? If they're going to be like a psychiatrist or psychologist or a speech person or any, they need to see more of what, at least for the spectrum, you need to see a lot before you have any idea of what to do. That alone, I mean, could take longer than a lifetime.
I know it. I know. We have just some of the things you touched on are actually in our workforce campaign.
Yeah.
And one of them is a similar program to City Year that we were hoping to get going. Our big push last year was just increasing the rate of pay, because that was like, if we didn't get that up, we were gonna not have staffed facilities. But after that, we started to look at like, how do we get into the high schools and motivate people at the high school level, at the college level? Colleges are totally getting rid of their human services degrees.
Yeah, it's just
like
wrong.
Nobody's graduating with this as a career in mind.
Right.
You know, I just talked to a young guy yesterday, he's 23, and he has made this, you know, life-changing choice to leave his job at 23 in finance to go into direct care. And he has a cousin with autism, so he's all like, I want to do this. And he was asking me about the pay and the career opportunities, and I was like, what do I say?
Sort of like a market crash,
yeah, that's true too, but so hopefully, you know, like if you get a chance, go on the ARC website /workforce, and you can look at some of the stuff. It's a little outdated now because we haven't been jumping on it, but I definitely like some of your ideas, and I'll bring them to Leo.
Well, you know, it's just some way to think about it, and maybe just incorporate people to, because how are they going to consider it? They don't even know what's out there.
Yeah.
The families are kind of being pushed more on an island. And that's not really right. You know, it's too much. And it's already a lot for a lot of families anyway, depending on the nature of their child's, you know, situation and all the health considerations, and it's a lot. And maybe there's more people out there that would be more interested in these kinds of jobs if they knew what was there. And, you know, but the pay is, there's no question. The pay is appalling. It's appalling. It's embarrassing, actually.
You know, Joanne Simons does the ARC Tank every year. Have you seen that?
Yeah.
Really cool, right? And she actually funded, I know, she's amazing. She funded this program, which is so fantastic. It takes, I think it's 10 individuals who are planning to go to medical school, and they take a gap year. And in that year, they get exposed to every single aspect of living with a person with disabilities, with intellectual and developmental disabilities. So they go into the schools, just what you were saying. They get
no kidding. Of it. Okay.
They go to day programs. They get a little taste of that.
Oh wow.
So it's really cool, and it's just I think it's in its second year up and running. But I'd love to I should probably do a little like investigating on how it's going. But so it's just so hard. You got to find people who are willing to pay those, you know, for those programs to get off the ground.
Right. Well, yes, I know it's difficult. There's no question. But again, there's so many college kids who are considering maybe not going back.
Now might be the time. Yeah.
This might be a great time to just seize that moment. There's people that are used to being busy. They know nothing about this world, and they're in a formative time of their life, and maybe they should step it up, you know, and try to help out. And again, yes, it's a risk zone, but there's an element of risk to everything, and they're younger, and maybe they can handle it, and maybe they should give it a try, you know.
From your perspective, do some of the aides coming in, do they have a leg up at all if they have their registered behavioral tech certificate, you know, that RBT?
Yeah.
Does it help? No?
Well, long story, of course. So we've hired, you know, most of the people that tend to stay are like myself. They have children who are younger, who you want to have that school age time frame for work. You want that 6 hours to work because it makes your life more livable. It's not for the pay. And it depends. Most of the people who are in the SPED rooms have some familiarity either in their family or very close in their inner nuclear family, or they have some they already feel like they have a knowledge base and they want to give something back, or again, that same window, or both. the RBT training, usually what happens is as a town or a city does not want to train because then the people leave.
Huh. That's
So,
crazy.
I know, right?
But
it's
okay,
awful.
yeah.
It's awful, but that's the truth.
I was just thinking, you know, if
yeah.
these grads are home right now, maybe they go on and get their online RBT or whatever it's called, and at least
Yes.
it gives them something to walk in with. I don't know.
Exactly. Well, it's definitely helpful. There are some free trainings out there. You have to kind of look for them, but I can email you. I found one. So, in fact, they're encouraging some of the people to, hey Zane, hi buddy. So they're trying to get it so that people will train. But again, they're not paying us extra for it. It's optional.
Right.
You know, it's all that stuff. It's on you, on your time, blah, blah, blah. And who has the time? But, you know, we make the time because we want to. But again, it's helpful if you have any kind of background with that. It's great. It's really informative. That it doesn't hurt. That's for sure. It doesn't hurt. The pay is terrible. They've hired some people that I think they just really had, you know, they walk around like zombies, like they're not really able to care for this. But it's also like, again, you've asked people to come in to help with a high need population. Yep. where the teachers are asked to have at least one master's degree, right? Or more. And like the BCBA, same, like they, you know, right. And then the technician, so to speak, it's like that game of telephone, right? Like where you pass the message as a kid and you're trying to get this information from one level or a technique to an untrained group. It doesn't really work great. Right. Or they misinterpret it, or they, you know, I don't know. I've seen a lot of really weird things. But the people want to help, I think, but they don't know how. Yeah, they need some training. I would say at a bare minimum, you need some basic training. Maybe some of that could, again, be like a program that people could go through and learn something before they go into help, some basics so they don't take it so personally.
Yeah,
you know?
Exactly. Give people
and then
something.
Say, yeah, these are the expectations and this is the health standards and it's nothing personal. This is just what we do here.
Right.
It's just basic level of care to improve the care that these individuals deserve. And, you know, the families would really hope for, and even at the school level, some of it can be pretty bad. Like, and, you know, they try to screen people, but you can still get in some people that are hard to get out if it's a union and, you know, so then you have issues with that. And again, a lot of it does have to do with the pay level, I think, because at that rate, you're going to get individuals who really aren't necessarily ready for this kind of work or this kind of population. And it's like learning to drive on the highway. You know, it's not good. Yeah, it's too much of an ask for a lot of people. So at any rate, maybe with some like pre-training and it might be something, or like offset some college tuition, you know, like some kind of motivator.
I know, wouldn't that be nice?
Some kind of link like that where again, you don't have to pay them as much, but you reduce some costs that they have, or, you know, maybe there's some way to appeal to people to get into we need more people.
Yeah, for sure.
And like you said, I don't think that people are hearing about it. Yeah, which is bizarre.
Right. All right, well, I have a 12 o'clock, so I got to run. But Jared, was there?
I'm so sorry.
That's okay. Did you need something, Jared? Are you all set? Because I'm going to hang up now, okay?
Can you send me the slides?
Absolutely, I will send the slides. All right.
Yes, please.
Thanks, Rose. All right, take care, you guys. Bye-bye.
Bye.